I'm RT. My name's Ron Tannebaum, and I'm the co-founder of InTheRooms.com.
I'm Kenny P, Ken Pomerance. They call me Mr. Clean on InTheRooms.com. I'm also one of the co-founders.
Hi, my name is Joseph Gorordo, and I'm the Vice President of Outreach for Recovery Unplugged.
Hi, Joseph. It's good to have you here today, along with Kenny. What's your role at Recovery Unplugged, and how has it changed in this pandemic since March?
Typically, my responsibilities are mostly centered around staying connected with my community and professionals in my community to ensure that they're aware of Recovery Unplugged and how we can help their clients. It's really been a shift to how can we still help people and support our communities and people who are suffering when we can't go out and about and do the things that we normally do.
Joseph, let me ask you a question. The pandemic's caused so much stress on everybody, but we know that people who are struggling with substance abuse are hit really hard right now. As a licensed chemical dependency counselor, can you give us some insight into why COVID-19 has been affecting addicts and alcoholics and mental health in general?
Having to either enter into recovery or trying to stay in recovery in this imposed isolation cuts off a lot of those support systems and makes it a lot easier for people to hide from accountability, hide from people that care about them. I think that that's a huge piece of why this has been affecting the recovery community so heavily.
We get calls every day asking about if treatment centers and recovery centers are open during this COVID-19 pandemic. And we say, yes, we know Recovery Unplugged, all of their treatment centers and facilities have been open the whole time. So can you explain to them what your resources are?
Recovery Unplugged is open at all our locations, and we are still offering all our levels of care. So that's detox, residential, PHP, and we are now offering virtual IOP, so you can still engage from treatment from the safety and comfort of your home, if that's the appropriate level of care for you.
How has Recovery Unplugged been dealing with the COVID-19 pandemic in terms of safety?
We're doing CDC screenings and questionnaires before admission. If there's concern of any sort of risk, we have them get tested before coming in. If we know for a fact they've been exposed, they got to get tested twice, 10 days apart, to be able to admit to the facilities. In addition to that, we've got ample amounts of PPE at all our locations. We've instituted some size restrictions on our groups to ensure that we're social distancing at all times. Clients and staff are wearing masks. We want to make sure that we have a safe place where once a client gets there, they can focus on recovery. And that means also creating an environment where they don't have to feel anxious about COVID.
So Joseph, someone who's sequestered and in their homes dealing with this COVID-19 crisis, and they have a loved one in their home grappling with substance abuse and going out and getting high and coming home and putting their family at risk. What do you have to say about that?
I know that when I was in the grips of my addiction, I had very little thought or consideration for anything that didn't involve getting money and getting drugs, right? That was all that mattered to me. And so first off, I would say, that's still your loved one. They're dealing with something that is bigger than them, that they can't control. And don't hold it against them that they're being selfish and self-centered, right? That's the disease part, right? But you still have a responsibility to take care of yourself and not enable or engage in codependent behaviors. So I would encourage the person who's sequestered with the person in active addiction to stand up for their health, stand up for the safety of their family, and that might lead to a tough decision of saying, hey, you got to stay somewhere else.
Well, Joseph, we can't thank you enough for being here today and representing Recovery Unplugged. RT and I are really big fans of your organization. We've sent lots of people there over the years.
Kenny and RT, I have been sending people to InTheRooms.com since probably 2010. I'd say you got to get on this In the Rooms website and create the fellowship you crave on here, So, just so you know, you guys have helped me help a lot of people over the past 10 years or so.
Thank you for being here today. It was really wonderful, and you really brought a lot of information to the forefront. Thanks.
it's always an honor and a blessing and a responsibility to be able to share information that hopefully could help do just a little bit to change somebody's life.
Thanks.
Thank you.
Great.